Good evening, ladies and gentlemen. I am Afisika Kuziaou and I welcome you to the HIV and COVID-19 talk show today with the medical doctors Kate Essen and Vanessa Christinet. So welcome to you, Kate.
Thank you very much.
Welcome to Vanessa.
Thank you.
How are you doing?
Fine, thank you.
Good, thank you.
So Kate and Vanessa, you will both work at the Fondation Profa, where it's about sexual health and HIV prevention. Would you like to say something more about your work?
Yes, both of us work at for Profa. There are a number of different services, and I work in two of those services in the sexual health clinics, which are for anybody can come, and we talk about contraception there and offer HIV testing, STI testing, and talk about prevention. The other service that I work at is Checkpoint, and Vanessa is going to say a bit more about that. There are also a number of other services in Profa, including our service education, who go into schools and give sexual education to the young people at school.
Mm-hmm.
There is couple counselling for people that have difficulties in with their partners. And finally, another service called the LAVI, which is for people who can consult who are victims of sexual or physical violence.
Thank you.
And finally, I almost forgot one, perinatalité, which is for women who are pregnant who would like advice and are looked after by their midwives.
Okay, during your pregnancy in general.
During their pregnancy, and if necessary, there are social workers to offer advice as well.
Great. Thank you. And you, Vanessa?
So me, I'm in charge of Checkpoint, which is a community sexual health center for men who have sex with men and transgender persons. Mm-hmm. So we are mainly in charge of HIV prevention and sexually transmitted infection treatment and prevention. But I have several patients who are living with HIV, and I'm in charge of their treatment.
Okay, thank you. This is why we are happy to welcome you as experts of HIV prevention. You have seen many things, and I'm very happy to have you here as guests on behalf of Diaspora TV.
Thank you.
So since the outbreak of the global pandemic, COVID-19, people have been busy about strengthening their immune system so that they can be prevented from being ill. And what would you say about people who are living on HIV, who already have a weak immune system? Are they at an increased risk of contracting the disease COVID-19?
So apparently not. From the data we have from Wuhan in China and from New York as well, the proportion of hospitalized people with severe COVID disease, there is not a higher proportion of HIV-infected person than in general population. Okay. So this makes us think that HIV is not a risk factor for COVID disease. But still we are very careful, and most of HIV persons living with HIV are treated and have undetectable viral load and a high CD4 cell count and are not immunosuppressed. Mm-hmm. And for this person, the advice would be the same as for the general population. We would be probably a bit careful with people who are very, very immunosuppressed, who are not on treatment, and who may be more vulnerable to COVID-19.
I see. But now you were talking about cases in China. Do we also have statistics in Europe?
Probably, but the main statistic I've seen comes from China, where there were a lot of information right at the beginning, and the last statistics I've seen were from New York city, where there were a huge epidemics, and quite a proportion also of HIV, of people living with HIV. And in this area, the proportion of person living with HIV who contracted COVID-19 were seems to be the same as for general population.
Okay, so no significant
Those
No.
who
Difference.
those who presented with severe disease, the numbers are similar to those of the general population.
Okay.
But I think it's also important to say that it is very important to take your HIV treatment, because obviously if there are gaps in HIV treatment, this can alter your defenses, and therefore it's very important to continue to take your medicines.
Sure. And have you maybe heard people arguing that people who are living on HIV and have antiretroviral treatment might be more resistant to COVID-19 because they're already on some treatment? That will lead me to another question afterwards, but have you seen any papers or articles talking about that?
So we have some hypotheses that some antiretroviral treatment, so treatment for HIV, may be useful to treat COVID. But this, at this level, right now, it's hypothesis. We have absolutely no data that can confirm this. And a lot of studies, more than 50 studies, are conducted now to try to test if these antiretroviral are effective. And a few of them have already been released and seems to show no benefit right now. But we still have a hope to combine some other treatment, and maybe we will get something. But for now, the data are unfortunately not so encouraging.
Okay, so now in the progress of those studies, have researchers already said something about the similarities between the HIV and the coronavirus in the type of virus?
I think both infections are completely different. I mean, apart from the fact that both are virus, they are completely different type of virus. The pathogenesis, the way the virus acts is completely different. So I think we should probably not compare these two viruses because they are not the same. But it's true that some drugs were tested in the laboratory, and some drugs that are used to treat HIV seems to be also active against the virus of COVID-19. But there are many drugs, other drugs, anti-psychiatric drugs, anti-cancer drugs that have also shown some effects. But it does not mean that the effect is seen in the laboratory, that it will also work in human. Okay. And this we should absolutely test it in well-conducted randomized trial to be sure that the effect is working and that it will have an effect on the COVID-19 disease.
Okay, so you would not say anything encouraging right now about the use of antiretrovirals?
It's not possible to say that. You need to wait for the research, the results of these studies that are ongoing.
Because the treatment might have side effects, might be worse than if there is no benefit, then the side effect and the side effect of the treatment then would be more important than the benefit.
Exactly.
And this we should be careful with that.
This is what we sometimes forget. It is that we think either we have something, it is getting better, or it's neutral, but it's not the case. It can be worse afterwards if the treatment is not appropriated. Yeah. So my next question is, according to the World Health Organization, antiretrovirals are also used to prevent HIV infection, the transmission of HIV. Has something been said about using antiretrovirals to prevent the infection of the coronavirus?
So what you call is PrEP, pre-exposure prophylaxis?
Exactly, the pre-exposure
which is something that we use as prevention.
a lot at Checkpoint. There are more and more people coming to Checkpoint. It's something that is frequently requested.
And it's very effective for HIV, and it's a very useful tool to prevent HIV. Unfortunately, for COVID-19, we have absolutely no data. There is one study, one prevention study that will be conducted in Spain to see if it works against COVID-19, but the data are very, very scarce right now, and we can absolutely not say anything about the efficacy of this. It may have absolutely no efficacy. This we need to test it first.
Also.
I think people need to remember that this virus is a new virus, so it has only been around since December or January, talked about since January really. And
exactly.
So to have these studies are ongoing, and it takes time to get results, which may, of course, not always be positive results. They may just show that, in fact, hypotheses were only hypotheses and there aren't any positive, nothing positive is coming out of them.
Exactly, because statistics need to be, there needs to be really evidence of significant results so that we can say that something has an effect or not.
Exactly.
Right.
Yeah.
But just to clarify for our audience, the prophylaxis that you use, it's used on people who are at risk to be infected, but don't have the HIV yet, right?
Exactly.
Okay.
It's two antiretroviral drugs that are combined in one pill that people take before and after the sexual exposure, and it prevents very effectively the transmission of HIV. And it's really dedicated to persons who are not HIV positive.
Exactly. Yeah.
But it's also important to not confuse with another type of HIV prevention, which is post-expositional. So this is a medicine that you take before that you might be exposed to HIV, whereas there is, in case of exposition to possibly HIV, or you don't know if your partner has, or the sexual partner has HIV, you can seek out a treatment that will, after having had sex with that person, can prevent transmission of HIV. So the two have quite similar names, PEP and PrEP, and they're not to be confused.
Okay, I see. Why would people seek to take the prophylaxis before being exposed to HIV, where they could use other methods to protect themselves?
It's one of the methods, HIV prevention methods. In the past it was condoms, but now there are different HIV prevention methods, and PrEP is one of them since 2016 here in Switzerland.
And I would say it would be mainly dedicated to very vulnerable group that probably with condom only it's not enough, and they still being exposed to HIV. So PrEP is something to be added to the condom use, and it would be for example men who have sex with men, or person coming or who have lived a long time in a high endemic HIV endemic country and who are more exposed. So this would be the person who would really benefit from this pre-exposure prophylaxis.
Okay, I see. Now coming back to COVID-19, you already said that there are studies being conducted about the use of antiretrovirals to treat COVID-19, but there are no significant results yet that can be said. What would you say about the herbal treatment that the president of Madagascar has talked about, called Artemisia? Do you is there some evidence about the effect of this drug?
I think Artemisia is very famous because it's led to very effective drugs against malaria. So it's a very, very effective drug, and this really changed the way we treat malaria. And but I think for now we have absolutely no ideas and no evidence of the effect of this plant against COVID-19. It may be, as all other drugs we are evaluating, but we have no more data on this drug or on this plant, on the effect of this plant, than than the other drugs we were talking about before. Okay. So I think it's, and the risk probably with, because we were talking also before about the benefit and the risk. The risk of using Artemisia too much may be that it could induce a resistance of malaria to the drugs. And that is something that is completely hypothetical now, but probably it's something that needs to be considered.
Sure.
If we have no efficacy, no evidence of efficacy.
Exactly.
So all these drugs really need to go through these trials, which are correctly carried out and are normally, there's randomized, that people take medications that they don't know whether they're taking the actual drug or whether they're taking the placebo one, and this is very important.
For sure, for sure. While you were talking, I was thinking about pregnant women who might have the virus of the COVID-19. Is there a risk that pregnant women transmit the virus to their child, either before the child is born or afterwards?
Again, this is something that the virus is new, so they're continually looking at these, whether this is the case or not. Initially, from what I have read, the vertical transmission, as in from mother to baby while the baby is still is unborn, was not thought to be an issue. There is a recent study going on, or still going on in the UK, that suggests potentially that might be the case, that there is this transmission, but again, it's very early on. What seems to have be the case is that babies that do get COVID have a very mild disease. So I think this is reassuring. And also pregnant women, unless they have other specific risk factors, do not seem to be, from the early studies that are being done and the ongoing study in the UK, that they don't seem to be at greater risk than the general population for having serious disease.
Exactly. And what about, so when women give milk to their babies, is there a risk of transmission there through the milk?
Well, again, that's really, they don't think so, but again, that is another question that to be looked at. But there is, breastfeeding is recommended. It is very important. It helps to protect the newborn baby. It passes on antibodies to protect them against different types of infections. So it is encouraged, and each woman should be able to decide whether she wants to breastfeed or not. What, of course, what is very important, that a relationship is built between the newborn baby and the mother as well. So of course they are going to be together and close. So if there is the coronavirus, the COVID, the mother has it, there is a chance that it may be transmitted by close contact. And recommendations as for the rest of the general population they are recommended, of course, to wash your hands regularly and possibly wear a mask, but again, that's another individual decision.
Well, the use of masks has been questioned, of normal masks, because there is, it's very wet inside of the mask, and that can attract the virus even more because it sticks to the humidity. So if really people should use masks, they should be really specialized masks with a breathing component. Do you know something about that, about these masks?
So there are several types of masks, and the most used masks are really most to prevent transmission from someone who is ill. So I think people who are symptomatic or have suspicion of symptoms, they should first stay at home. But if they need to go to the hospital or to take public transport, they should really wear this basic mask, this surgical mask. And these are the ones we use at the clinic to protect our patient. Mm-hmm. But these are not masks that are built to protect the person who is wearing it. And then the masks you are talking about are the masks that are the one to protect the person. Exactly. And these are recommended mainly for people who are making, for physicians, doctors who are making activities that expose them a lot to the breathing of their patient.
Who are working with people with
COVID and who are making specific procedure. Even in the hospital, the main doctor, they don't use this special mask. Okay. Only if you are very exposed to the air, the aerosol, and these are the high-risk patients, and then you should absolutely wear this mask this breathing mask.
So nurses, rather nurses who are near to the patients, probably.
Usually nurses and doctors at the hospital, they use the surgical mask. And it's mainly also to protect the patient, because in Italy or in some country like this, the health professional were source of patient infection, because they were exposed to the patient and they were infecting other patients from the hospital. And this is a big problem. So mainly the surgical mask that people are using in the hospital is really to prevent the transmission to uninfected patient as well. This is a very important point.
Okay, yeah, I see. Yeah, there is even now a lot of fashion about masks that are also made with fabrics and so on. I really ask myself how effective those masks are, apart from just being fashion.
I think, but I mean, I'm not specialist of masks, so what I tell you about is what I've read in the literature, and some experts may have some other ideas, but I think it's a bit what we have looked at, and the barrier masks, the tissue mask, they may be useful, but we have absolutely no data on this.
Okay, I see. So now coming back to medical evidence that can be gained to treat COVID-19, besides the studies that are going on regarding the use of antiretrovirals to treat COVID-19, are there other studies that are being conducted at the moment that don't have anything to do with antiretrovirals, but are other paths of studies?
Yeah. Yeah, in WHO website, you can find freely all the studies that are repertoriated, and for clinical essay to evaluate treatment, there are more than 800 studies.
Wow.
And most of these studies are concerning anti-psychiatric drug, anti-cancer drug, and other drugs that we know already. That we know they are safe and that they may have, according to what we see in the laboratory, they may have an effect on the SARS-CoV-2. Okay. And so these are the studies that are being now conducted, but we don't have any proper data on the efficacy of this, but researchers are really looking for treatment.
Is the research conducted on animals, or how is it done? Is the virus isolated and being tested in a way, or there are also experiments on animals in the laboratories?
Usually, I mean, in general, you test first in the laboratory, they look at the protein and they see what might have an effect on the virus. And the following step is first to test it on animals to see the toxicity, to assess the safety of the drugs. And when the dosage is evaluated, then after the study are conducted on a little number of human beings, and we also
normally volunteers.
They have to be volunteer. They have to be aware that it's a study. They have to agree the risk, the benefit. They know everything about what we know about the treatment, and they need absolutely to agree. It's not allowed to test these drugs on persons who are not aware of this. This is illegal.
For sure.
So, but in CHUV we have a lot of study and persons who are volunteered to test vaccines, medicines.
I think it's an interesting, vaccinations, for example. There are, of course, people looking at can we find a vaccination for COVID, the new coronavirus. But in ordinary circumstances, for a vaccination to be produced, it takes years and years. It has to go through the process that Vanessa has just described. So you can be looking at 10, 15 years. Now, if you speed up this process a lot, but maintaining the safety as well, the minimum really you can be, and I'm still talking about vaccinations, from what I've read is 18 months, 2 years.
Okay.
So it's not a rapid process, and vaccinations are different from medications, from treatment, but that gives us an indication that we need to be patient, unfortunately.
Sure. Yes.
Yeah.
Surely treatments, the evidence for treatments can be seen more rapidly than for vaccines, right? Because you see the effect on the patient after a short period of time. You see whether the person has recovered and whether after being tested the virus is still there or not.
Yeah, you still have to go through these stages. You can't skip the stages, and it's very it's rigorously the people that are in these studies, the humans that are in these studies, are cared for and protected. But yes, a study that is ongoing for 6 months rather than trying to produce a vaccination, yes, will be
exactly
quicker.
There's a call coming in. I'd like to take up a question from the audience.
Hello.
Hello. Hello, I can't hear you well. Can you please talk louder?
Yes, good evening.
Good evening.
Good evening.
My name is Maria.
Hello, Maria.
I'm calling from Zurich.
Yes, and
I have a question for our guest.
Please go on.
Related to vaccines. If during 25 years we know about HIV, we didn't find vaccine to prevent HIV, do you think we will find soon a vaccine for coronavirus?
It's a very good question. I mean, as I said before, there are very different viruses, and HIV is a very tricky virus, and it's very difficult to find a vaccine. We have been trying for
Maria, thank you for the question.
For several years.
So our experts are answering now. Sorry,
sorry.
Vanessa, please go on.
So sorry. Should I start again?
Yes, please.
Okay. So yes, I think, Maria, it's a very good question, but we need to understand that HIV and SARS-CoV-2 are very different viruses, and I really hope that we will have more success to find a vaccine for SARS-CoV-2 than for HIV, because for HIV we have been trying for several years, for more than 30 years to find a vaccine, but HIV is a very tricky virus, and hopefully SARS-CoV-2 may be easier to address. But I cannot really say right now if it will be rapid or not, but I think there are some hopes, and there are a lot of researchers who are working very hard on this question. There are a lot of study being conducted, a lot of hopes, and I think a lot of energy also from the whole world, and a lot of money is put into this, and I think people are doing their best to achieve this goal.
Thank you. Thank you, Vanessa. You wanted to say something, Kate, about that?
No, I don't think so. I think that's right. I think we have to wait and see. But as you have said, lots of people are very putting a lot of their energy and expertise into trying to find a vaccination. And we have to remember that the two viruses are not the same. So hopefully there will be more, something will come in the next more easily
Yes.
for the SARS-CoV-2.
Yeah, thank you, Kate. This brings me to, there are some rumors that if it can be, there can be evidence that antiretrovirals can be used for treatment against COVID-19. There might be a disruption in the supply of antiretrovirals for people who are living on HIV. So what would you say about that?
I think this is why it's important to have this discussion today, so people are not taking drugs that are taken away from the people who really need them, and that may have bad side effects on them with no benefit. So really this is the message, the most important message today, to really let the treatment for the one who really need it and who really have a benefit of it, who are the person living with HIV.
But in Switzerland, there isn't a shortage of HIV treatment, so it is there. What is very important to make sure that you don't run out if you're on HIV treatment, and contact your doctor or your specialist centre. We have been, throughout the coronavirus crisis, despite quarantine, we have still been having telephone consultations and seeing patients, if necessary, in the clinic, which will be the case for all doctors.
Okay, thank you. Well, there's a telephone call coming in. Hello? Hello?
Hello.
Hello? You'd like to ask a question?
Yes, I've got a couple of questions.
Ah, so where are you calling from?
I'm calling from Bern, Vabern.
And your name, please?
Mbene.
Mbene, hi Mbene. What is your question? Please go on.
The question is that how many people infected with HIV in Switzerland, and which group is the most vulnerable? And are the figures going up or going down?
Thank you, Mbene, for your question.
Thank you very much.
So, hello, Bene. So every year there is more than 400 new infections in Switzerland that are reported to the national health authorities. This number is going down now. I think we can say that the most affected group is men who have sex with men, because they account for almost half of these new infections each year, and in the general population they represent only several % of the whole population. So with this number you can probably see that they are a very vulnerable group to this infection, and they are one of the main beneficiaries of this pre-exposure prophylaxis.
Okay, thank you very much.
Did I answer the question?
Hello, Mbene, are you still on the call? He's gone. But yeah, I guess so,
okay.
when I analyze his question. Thank you very much. Now, talking about experiences at the Fondation Profa, where you work, what are your experiences with COVID-19 for people living on HIV and also who have contracted the virus? Did you have patients at the Fondation who where there was a concern?
As I said earlier, at the beginning of confinement, we changed our practices. Certainly in where I work in the consultations for sexual health, we changed to telephone consultations, the majority of telephone consultations. And
okay, sorry, there's a call coming in. Hello? There is no caller. It was a false alert. Please go on,
and we
Kate.
saw people, only people that really needed to come and be examined if there was a particular problem. In Checkpoint, however, we continued to have our consultations open. People came to the clinic. We changed the practice a little bit so that there were less people. The consultation times were spread out, so to try and maintain social distance, which of course was important. We always wear masks now and then. As far as talking about coronavirus, there were people, of course, with questions about coronavirus and just general questions more than anything.
Okay.
I don't know whether there were many people talking who living with HIV who were also asking questions about coronavirus, and whether there were any special precautions to take.
Most of the patients that are followed at Checkpoint are really are completely well controlled with the medication. They have undetectable viral load. They have very high CD4 cell count, so they were not at all part of the vulnerable group. There were some worries from the patient, from 1 or 2 patients, and I could really discuss with them. Some could work from home, so they were reassured, but it was not really, I didn't feel really more fear than the general population, and we could quite rapidly reassure them with the data we had from China, that really for people who are not immunosuppressed, who have undetectable viral load, there is no higher risk than for general population.
Okay, yes, thank you very much. There's a call coming in. Hello?
Hello.
Hello.
Hello. Please tell us your name and your question.
It's Mbene again.
Hello, Mbene.
Hey. Thanks very much for the answer, for the response to my question. The follow-up question to the response that the people that are most vulnerable are men that have sex with men, and why? Is it because of the act of sexual engagement itself, or is it because of a lack of particular information?
Thank you.
Thank you very much.
Thank you.
Can I answer?
Of course. Yeah. Please go on.
Okay. It's for probably there are several reasons for that. It's probably for anatomical reason, and also for number of sexual relationship and numbers of partners, and also for the size of the group. It's a small group, and the contact between person is very close, and so the infection is spreading much more rapidly in a close small group than in a big group. And these are the main reason why. But I mean, we can be men who have sex with men and have no exposure. It depends on the sexual practice, and condom is effective, but it's not always easy to use, and PrEP is really important as an additive tool to be relieved of this infection that has a lot of
still a lot of stigma.
A lot of stigma and a lot of burden. The burden of the disease was very heavy for the MSM community. So now it's really a kind of way to get released of all these years of traumatic history.
Thank you very much.
But I think at Checkpoint it is important to emphasize we spend a lot of time talking about HIV prevention individually with people, because as Vanessa says, everybody is different. A condom, many people can use condoms very well and there's no problem. Other people have difficulty with that, and discussing ways to talking about this new form of prevention, which has relieved a lot of anxiety as well for a group of people that were more at risk and would have had probably friends they knew who had contracted HIV.
Thank you. Thank you. Let me think about people living on HIV. I mean, you work at the Fondation Profa and people know that they can ask you questions. You were able to tell them that they were not at higher risk when, based on the data from China. But on a national level in Switzerland, did people who are living on HIV have a privileged access to be tested on the coronavirus? If they were worried now in the hospitals?
To my knowledge, not. And I wouldn't see really the purpose of it, as they are not considered at higher risk. And I would not suggest to my patient to go in an area where there are a lot of suspect patients, and this would increase the risk of being in contact with someone who has the virus, and therefore increase the risk of being infected. And until recently, only the person with suspect symptoms were supposed to do the test. So I think someone who is HIV positive and who has symptoms should have access to the test as any other person. We should not make any difference from this. And now, since 1 or 2 weeks, the test is really offered to the general population who experiment symptoms that are suggesting COVID-19 infection.
And not only the severe symptoms, which it was up until recently. Anybody with any sort of mild symptoms can also get tested.
Exactly. So what I meant before was rather the anxiety of the people themselves. The hospitals know that the people living on HIV are not at higher risk, but the people themselves might have been anxious about that. But it's the past now. Now
and
they can,
And I think most of the people living with HIV, they have very close contact to their doctor because they see their doctor every 6 months or every 3 months, and therefore there is really a trustful relationship between the patient and their doctor. And I'm sure that a lot of my colleagues have contacted their patient and discussed with their patient to inform them about the risk. But this was mostly performed through telephone calls to avoid people moving, because this was the recommendation, and it was better for everyone.
I see. Thank you. So thank you very much for your answers. Is there anything you'd like to add to the discussion before we end the show?
Thank you.
Just to say thank you very much for inviting us, and hope our answers have been helpful.
They have been helpful to me, and I think to the audience too.
Thank you very much.
Thank you.
Thank you very much. This talk show is produced with the support of Federal Office of Public Health under the National Program HIV and Other Sexually Transmitted Infections, NPHS, and also from the Canton Basel Integration, from the Rudolf und Ursula Streit Stiftung, von der Fondation Profa, Lausanne. And thanks to our guests and audience, as well as to our technical team for the smooth running of this debate. Wishing you a great evening.